Hey, my name is Dr. Cozy. It's really nice to meet you. And really quickly, just before we get started, can I have you verify for me your name and date of birth? Perfect, okay. Okay. I see in your paperwork we have you here for some ear pain bilaterally, and it's extending down the neck. Okay. Have you had any recent colds or congestion, any sore throat? Okay. How about any diminished hearing? Any kind of pressure in your ears, ringing, whooshing? Great. How about any dizziness, any loss of balance? Okay. Is the pain you're feeling, is it both sides? Are they equal on both sides, I mean? Or is it more painful on one side than the other? They're pretty equal. Okay. Is it disrupting your sleep at all? A little bit. Okay. Oops, I just drew on myself. Okay. Do you feel like you're well rested? Do you feel when you wake up in the morning like you're really exhausted? Or do you feel like you wake up refreshed? Okay. And can you rate the pain level for me on a scale of 1 to 10? 1 being very minor, like a paper cut maybe, 10 being excruciating, like really disrupting your life. Okay. Alright. And is that the same pain level as the level of pain that's like radiating into your neck? Yeah, okay. And then a question that we ask all of our patients, which is, how are your stress levels? Okay. Do you do anything to manage your stress, like yoga, meditation? Okay. All right. I'm going to put on some gloves here really quickly. Okay, then I'm going to take your temperature just to help rule out the presence of any kind of ear infection. I'm just going to move your hair. Sorry. Just need a clear spot for my thermometer. Okay, the temp is normal, 97.9. All right, let's take a look. Okay. going to switch out my otoscope cover so I can take a look in your nostrils. So, just gonna gently slide it in. Okay. Nostrils are nice and clear. I'm going to take a look now at the external ears. I will be palpating using my fingers, so if anywhere that I touch feels tender, feels uncomfortable, please let me know, okay? It's helpful information to know if any particular spot causes discomfort. Gonna feel right here in this little corner between your earlobes and your jaw. Can I have you open for me? Perfect, thank you. Okay. Throat looks nice and clear. I'm not seeing any kind of tonsillar swelling or redness. No evidence of postnasal drip or drainage. Okay, keep your mouth open. I'm going to remove this and take a look inside your mouth. Can I have you open just a little wider for me? Thank you. I am noticing on your molars, it looks like your teeth have been ground down quite a bit. And I am seeing some chipping back there. You can relax your mouth here. I'm gonna palpate along your jaw. Yeah, these muscles are feeling awfully tight. Okay. Feel around your neck, starting in the back of your head here. Now your sternocleidomastoid muscles, they attach here behind your ears, and they start at your sternum, your clavicle, and then they kind of attach here back behind your ears. And they're feeling quite tense, which is what I'm thinking that neck pain is. That you're feeling if these muscles being really tight. Yeah. And considering where they attach, that also would explain some of the ear pain. Can I have you open and close your mouth for me? I'm going to keep my fingers right here on your temporomandibular joint. Just open and close. Okay, again. Again. And again. Okay. Do you notice yourself clenching your teeth? Are you aware of any grinding or clenching of your teeth that you may be doing while you're awake? Okay. Is the discomfort more like when you just wake up? Okay. So these muscles in your face along your jaw are awfully tight as well. And I have a sense, given how hypertonic these are, along with the neck pain and the appearance of your molars, I think you might be grinding your teeth at night. Has that been something that you've had any kind of Is that something that you've had any kind of awareness of in the past? Okay. Are you currently under the care of a dentist? Okay. What's their name? Okay. So I think it would be really, really good to go and see your dentist, have them examine your teeth, maybe kind of even them out from some of that grinding and chipping, and then really to be fitted for something called a mouth guard, which you would wear at night. And even if you do clench or grind your teeth a bit, your teeth will be protected by the mouth guard, so it's not going to cause any more damage. And I think that's really going to help, along with finding some kind of stress management, especially before bed, because that kind of stress can sort of build up in your system, and our bodies tend to release it, sometimes in ways that we're not even aware of, such as grinding your teeth, clenching in your sleep. So whether that's meditation, yoga, some people run to relax, watching ASMR videos, whatever it is that works for you, can really help if you make it a daily practice to alleviate that pattern and that clenching and grinding. So in the meantime, I would like to provide you with some symptomatic relief. It's not going to relieve the cause, the grinding, the bruxism, that's what it's called, but it will help you be able to understand how to manage and take care of it when you're in really a lot of pain. So the first thing I'm going to do is kind of prime the areas, the muscles, with a heat pack. These you can find at a pharmacy. sometimes at grocery store it may be a different brand, but I definitely recommend these. Here we use the disposable ones because it's more sanitary for our patients, but a reusable one also is totally fine. They have some that you can microwave, or even a heating pad that you turn on that can really help. Okay, so that's one. And I'm gonna do a second one. That other one didn't pop quite as well. And two. So, I'm going to hold these on either side, and I'm going to have them kind of cover both your neck and your jaw. So, just let me know how the temperature is for you. Is that okay? Is it too warm? Okay. If it starts becoming too warm, let me know, because I can add another towel without a problem. When was the last time you went to the dentist? Okay. Did they notice anything at the time? Distracted by cavities, okay. Just a little longer. Just a second. I'm actually going to adjust my stool if I can find the lever. There it is. There. Just so that way I have better control. Okay. The heck is the lever? There it goes. Okay. So, just gonna feel relax your CM muscles a bit. Your jaw. Still a bit tight. So, okay, now is where some massage techniques can be handy. I don't have a gua sha here, but that can be really helpful in terms of massaging the sternocleidomastoid muscle. So you'd want to bring it down and across, okay? So like here. Alright, and then I'm just going to use this because it's easier to see. You want to move it, laterally across the muscle fibers. So down in the direction of the fibers and then across. And that's going to help and provide some release. In terms of the jaw, using these knuckles helps to kind of run your knuckles along the jawline, okay, in between. And your facial muscles can actually be a bit more delicate, so you're not going to want to use too much pressure there. You want to be gentle with yourself. I don't know if you've ever seen one of those like facial yoga video routines, but there have been times where myself, I've followed them and gone a little bit too hard and ended up with a sore face. So it really doesn't take a whole lot. So I'm gonna start and do a little massage on you, okay? Just so that you can see what it should feel like. So I'm gonna start with the jaw. I'm gonna do each side by itself. Not going to overdo that part. Give this a second to just relax a little. Okay, so now I'm going to be moving laterally, smaller motions. A little tense. going to massage your temples very lightly. All right? And in a moment, I'm going to put pressure. I'll have you open and close your mouth a few times. Open and close. Open and close. Good. One more time. Open and close. Going to bring these back for just a moment. Okay. So after that massage, some warm packs yet again can be helpful just for the first few days, and then you'll want to switch to cold. But first we want to try and teach these muscles how to relax, because they've really gotten tight to the point where you can tell they feel like they need to protect you. But that's also causing pain. So the heat will help it relax, and then we can address the inflammation. But where's my pen's over here. Okay. Let's go for the first week just using heat, okay? Okay. And then, so you're going to want to make an appointment with your dentist as soon as possible. I'm going to write up a note really quickly so that way I know exactly what I want to send them. So Okay. So I'm going to type up a note to your dentist, letting them know my findings from today's exam, as well as what I suspect is going on. In the meantime, I would like you to repeat the massage that I performed on you today, twice a day, every day, okay? Using heat before and optionally after. Really important that you find a stress management routine. Sorry, I thought I saw something on the wall behind you. I do not. Must be like a fuzz in the air. Never mind. But again, like yoga, meditation, some people like to do like meditative running, exercise classes, even for some people. Whatever that looks like for you, that's something that you can do on a daily basis, and it doesn't always have to be the same thing either, okay? I have a hard time with meditation too, I totally understand. But actually, one thing about that has helped me a lot is somebody told me once that it's okay to let thoughts come into your head, that you don't need to work so hard to keep your head clear. That takes practice. Instead, just whatever thoughts come in, think them, and then try to just let them go. And if another one comes in, that's okay too. And there are some guided meditations that you can find online that can be really helpful. Aside from that, using an anti-inflammatory like ibuprofen, Aleve is also going to help bring some relief to your jaw and your neck muscles as well. And then one more question, actually. Do you have any kind of special pillow, like a memory foam or anything that's like specific to your neck? Okay. If you don't have one, that's okay. I was just asking because there's a lot of different versions of those types of pillows, and sometimes for some people, some of the shapes aren't great and others are better fit. So I just thought I'd ask. But okay, let me just make sure I didn't miss anything. No, okay. So yeah, I'm gonna get this note typed up and faxed over to your dentist, okay? And you'll want to make an appointment there as soon as you can, because we don't want to risk you breaking any teeth. Grinding your teeth can really cause a lot of damage, as well as just make you very uncomfortable. So it's important that you get that mouth guard, all right? Okay. Yeah, I do recommend getting yourself fitted for one instead of one of those generic ones that you can buy on Amazon or at the store. The fitted ones are a lot more comfortable, which means that you're more likely to use it. Do you have any other questions? Okay, well then I'll get moving on this, and I'm going to send this to your dentist, and I will check back in with you in a couple of weeks and see how you're doing, okay? Okay. It was really nice to meet you. You take care.